Hi, everybody. Thank you so much to Carl Zeiss Meditech and Covalent Careers for helping organize this. It's my pleasure today to tell you about our work in using OCTA-derived metrics of retinal capillary density to assess changes in cognitive status in Alzheimer's and associated dementias. These are my financial disclosures. And since this is primarily going to be a mixed audience of neurologists, optometrists, and ophthalmologists, I just wanted to point out that we all recognize Alzheimer's disease as a very prevalent cause of dementia. But kind of the other elephant in the room, which may not be as well known, at least to the non-neurologists in the group, is cerebrovascular disease is a very prevalent cause of dementia that's probably equal to Alzheimer's disease by some counts. The prevalence of Alzheimer's disease doubles every about 4 to 5 years, and the prevalence of vascular dementia also seems to double about every 4 to 5 years, at least that is measurable. In addition, longitudinal or cross-sectional studies, population-based studies, demonstrate a significant amount of vascular burden, whether you're looking at autopsy studies or cross-sectional MRIs on population basis, that demonstrate cerebrovascular disease, even in people who have no clinical symptoms of cognitive impairment or neurological deficits. And in fact, it's been shown that clinically visible retinal vascular changes are associated with some of these changes on MRI, such as white matter lesions, cerebral microbleeds, or lacunar infarcts. Specifically, changes in the caliber of the central retinal artery or central retinal vein, as well as the presence of retinopathy lesions, such as intraretinal hemorrhages or microaneurysms, are correlated. And again, these are kind of cross-sectional studies, but perhaps even more significantly is that these retinopathy findings are also correlated with cognitive status. And these are also in population-based studies or even case control series. So what we want to do is see if we can use OCT angiography to look at the retinal capillary changes that occur before retinopathy happens. So before there's dot blot hemorrhages and microaneurysmal changes, can we use OCT angiography to identify vascular changes ongoing in the retina that may be also ongoing as part of small vessel disease in the brain, and hopefully provide us a biomarker to the progress of cerebral small vessel disease. So this has been an interest of our group for the last several years, and we've worked collaboratively with a number of groups. I'm going to describe to you results from a recently published study on Alzheimer's and dementia, where we were able to look at a pilot cohort of about 50 or 60 subjects. And these were subjects that were recruited from community-based recruitment of subjects, and primarily a Latino population, that had risk factors such as diabetes and hypertension that predisposed them to small vessel disease. These subjects were recruited through the Alzheimer's Disease Research Center at USC and through the MARC VCID study, which I'll tell you about a little bit later, and underwent a standard battery of MRI tests, cognitive tests, neurologic tests, including the UDS at the USC ADRC, and are very well characterized. And the summary document table is here illustrating our findings. And this is a small cohort, but nonetheless a pilot cohort that helped us get our research off the ground. So among this cohort of 50 or 60 people, we had about 35 cognitively normal subjects and about 15 cognitively abnormal subjects by UDS criteria. And I'd like to note most of the cognitively abnormal subjects were actually not Alzheimer's disease, not thought to be due to Alzheimer's disease pathology, but primarily vascular cognitive impairment. Or causes of due to vascular dementia. These are kind of the demographics of this cohort. MoCA assessments were performed on all the subjects as part of their clinical assessments, and CDR scores were also performed as part of their kind of overall functioning assessment. So the first question we wanted to ask with this cohort was whether we can take measures of retinal perfusion, such as measures of OCTA-derived capillary density, which you see on the right side of the screen here from the central fovea, and see if we can correlate that with some measure of intracranial perfusion. And it's hard to get capillary-based measures of intracranial perfusion because of the limited resolution of MRI and PET scans. But we were able to collaborate very closely with Danny Wang at USC and John Ringman to help look at some of the small perforating end arteries in the watershed region of the middle cerebral artery in the lenticular striate arteries that you see here. And this kind of black blood imaging is actually very high resolution, able to image arterioles on the order of about 100 to 200 microns, and able to provide us some analogous measure of microvascular flow almost at the level of capillaries inside the brain. And when we looked at the correlation between the perfusion of these lenticular striate arteries, which is a semi-quantitative analysis, and the quantitative analysis of our OCT output vessel skeleton density, we were able to see a strong, significant, and positive correlation between these two, much stronger than we actually anticipated, which suggests that cerebral, at least OCTA-based measures of retinal perfusion have some correlate, some pathophysiologic correlate to intracranial perfusion at the level of the arterioles and capillaries. The other thing we looked at in this population was kind of overall behavior or function. So clinical dementia rating scales were performed on all these subjects. And this is an illustration of a subject who had a CDR score of 0, which means that they were behaviorally completely normal functioning. And you can see that the capillary density on the pseudo-colored skeletonized map of the macula has some hot spots and some green and yellow spots, indicating localized capillary densities. And in subjects who had higher CDR scores, such as this subject, which happened to be one of the worst ones that we had in our cohort, you can see that there's fewer areas of these hotspots. So it seems like there's some level of capillary flow impairment in this subject that's very localized. It's hard to perceive when you look at the overall image, but when you look at the quantitative analysis, it definitely shows up. And in fact, when we look at kind of the whole cohort of subjects that we see that subjects who had a CDR sum of boxes score greater than 0 had almost a 4-fold increased odds of being in the lower tertile of the vessel skeleton density measures in our whole cohort. And this suggests that at least in a very gross level, the capillary perfusion in the retina may have some functioning, some correlates to overall function as measured by CDR. What we wanted to do was look more specifically at cognitive impairment, and that's what we used our Montreal Cognitive Assessment for. So when we correlated the MoCA scores with our vessel skeleton density in the same cohort, we were also corrected for education, age, gender, and language that the testing was performed in. We were also able to see a strong positive correlation that was significant in this cohort, suggesting that the perfusion of the retina at least has some pathophysiologic correlate in the cognitive status of a subject. And more specifically, we looked at MoCA subscores. So we were able to show that at least in this small subset of people, the visuospatial and executive subdomains of the MoCA really were driving the whole association rather than the other subdomains. And I have naming listed here, but there's other domains that we looked at that were not significant. But the visuospatial executive subdomains were significantly associated with the vessel skeleton density. And those subdomains are more typically involved in cerebral small vessel disease and vascular cognitive impairment. So this was also very interesting kind of supportive data for our hypothesis. So this pilot data set is being followed up with a much larger multi-center longitudinal study that's ongoing. It's called the Mark VCI Consortium. It's ongoing at about 4 universities around the country. The website is listed there, and our imaging protocols are published also in Alzheimer's and dementia, including the OCTA protocols and the MRI protocols. And we'll be looking at a cohort of several hundred subjects to try to tease out some of these findings and associations in a much larger cohort and hopefully confirm them to see if capillary level changes in the retina really do accurately represent what's going on not only in intracranial vessels, but hopefully in terms of cognition to some degree as well. So I'd like to thank my collaborators here. A lot of this work that I presented to you was done by a postdoc in my lab, Senyo Ashimati, as well as the Mark VCID Consortium, and also my collaborators at the Department of Neurology, especially JJ Wang, Danny Wang, and John Ringman at the Laboratory of Neuroimaging, and the collaborators I have at University of Washington, Seattle, Dr. Ricky Wang, and my new collaborators at Hopkins as well. So thank you very much, and I am happy to take any questions. These are the funding sources for the work that you've seen.